Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Abalada, and my co-host today is Karina Nance, Client Services Specialist here at Roots Community Health Center. We are reporting to you from East Oakland for the week of November 23rd. As health professionals rooted in Oakland serving some of the people most vulnerable to getting and suffering from COVID-19, we are here to cut through the noise to give you the information you can use to make the choices that will keep you, your family, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Please submit your questions in the comments, by direct message, or by email to admin@rootsclinic.org. This has been a rough month for COVID, and the month is not over yet. There have been over 3 million new coronavirus cases in the United States in the month of November alone. This is almost a quarter of the number of cases that we have seen in the United States since the onset of the pandemic. All of us in healthcare are bracing ourselves for the weeks and months to come. There are now over 27,000 cases of COVID in Alameda County and 499 COVID-related deaths. And there are now over 10,000 COVID cases in the city of Oakland. Here you can see daily cases from about mid-October to now. The last several days continue to be updated and will likely increase as more positives come in. But regardless, you can see that we are heading pretty quickly in the wrong direction. Similarly, you can see here hospitalizations, also from mid-October to now. Once again, heading in exactly the wrong direction. Right now, the county has about 38% of its ICU beds available, which is fair. We'd like to see this be even higher, and we will start to get worried when it gets down to 20 to 25%. So we will continue to keep an eye on this. Now, our testing sites and other testing sites across the county have been seeing demands like never before. In fact, on Friday, Roots testing site and 99th and East 14th tested more people than we have tested on any single day in the pandemic yet. This is due to a combination of factors. With the increasing case rates mentioned previously, that means more of you are getting that phone call from your friend, your coworkers, or contact tracers telling you that you've been exposed to someone who's COVID-19 positive and that you need to get tested. So we're glad you're doing that. It may be because you have symptoms that might be a cold or a flu, but they might also be COVID, so you're getting tested for that reason. And we're glad you're doing that. But if you are getting a test now so that you can go visit someone this weekend, we need you to understand the limitation and the flaws in that approach. First off, if you're going to visit someone who's vulnerable and you plan on having close contact with them, the safest thing to do is to quarantine for 14 days. Why? There's two reasons. One, the test does not become positive right away after you contract COVID. Two, you can contract COVID after you test negative. Either way, you'll think you're negative when in fact you're positive and contagious. The only way to truly guard against either of these scenarios is to quarantine for 14 days before close contact. Here you can see the basic timeline based on numerous studies and reports that have been gathered throughout this pandemic. Let's say you catch COVID-19 today. So that means you were in contact with someone who's positive and you catch it. If you get tested today or tomorrow, you have about a 0% chance of testing positive. And in all likelihood, you will feel just fine. Most people don't get any symptoms for several days. And some people don't get any symptoms at all. But either way, at this point, you are contagious. Somewhere between day 5 and day 8 is when your test will typically turn positive. So if you got tested between day 0 and day 5, you very well may test negative even though you are positive. If you thought that negative test was good enough and you go visit grandma, you might give grandma COVID. Second, you can contract COVID after you were negative. Let's say you get the test and you really are negative. Then you go hang out with your friends without a mask on and you catch COVID. And then you go visit grandma. You could give grandma COVID even though you thought you were negative because of your negative test, because you did not quarantine after you took the test. All of this to say, don't think a negative test is your ticket to visit. The safest thing to do in order to prevent infecting another person is to quarantine for 14 days before coming into close contact with them, especially anyone who is elder or vulnerable. You actually have enough time to plan this out for Kwanzaa, Christmas, Hanukkah, or New Year's, but not for Thanksgiving. We've heard from several of you that your families just do not understand why you won't come over or have them over for the holidays. Some of you have been accused of worrying too much. Others are out there feeling offended because you won't come over and don't understand why, because you know you don't have COVID. Others haven't made up your mind yet, or you're afraid to tell someone that you're uncomfortable with gathering right now. We get it. This is creating a lot of discomfort for a lot of people right now. We know that it's a hard call to make. Not as hard as the call to tell them that you have COVID and they need to get tested, but still a hard call to make. But we recommend that you go ahead and have the hard conversation. Let everyone express their sadness and their frustration. Offer to do a video chat or drive-by, or maybe just come over for dessert or something brief. To keep your stress level down, we recommend that you avoid getting pulled into conversations about whether COVID-19 is real or whether masks are important. Believe me, I know these can be very heated and frustrating conversations. You can't go wrong if you acknowledge other people's feelings and their disappointment or their frustration, and then explain your own feelings and your own boundaries. It may not be popular, but it can be the greatest act of love to go outside of your own comfort zone and set boundaries that will keep you and your loved ones safe. Now, if you will be visiting and everyone has not done the 14-day quarantine, then please be sure you do not come into close contact. Determining what close contact is depends on a variety of factors, but to keep it simple, as long as you mask up and space out, and especially if you stay outdoors, you will not have close contact. If you're outside and wearing masks and being mindful of your spacing, you will not have close contact. Remember, keep it small, keep it short, and keep it outdoors. Keep your circle small. Ideally, people from no more than 2 different households. In fact, mixing more than 3 households is actually prohibited per the state's orders. Keep it short. Less than 2 hours is safest. And we know it's getting cold, but keep it outside. That is safest. If and when you are eating, you should do so as far away as possible from non-household members, since you obviously must remove your mask to eat. Avoid spending time indoors with members who are not from your household. Do not share your air. And now my co-host, Karina Nance, Client Services Specialist at Roots Community Health Center, will go into more detail about resources related to COVID.
Hello, my name is Karina Nance. I am a Client Service Specialist here at Roots Community Health Center. As part of my job, I assist community members with signing up for benefits like Medi-Cal, CalFresh, and general assistance. While a lot of us are thinking about what we are cooking for Thanksgiving, others are worried about losing a roof over their head. And we are here to help. One program I want to tell you about in particular is Keep Oakland House. This program is available to those who have experienced a hard time paying their rent during COVID. You must reside in Oakland, and you cannot live in public housing authority or subsidized housing. You must reside in Oakland in one of the following zip codes: 94612, 94704, 94603, 94621, 94601, 94605, 94606, and 94607. Through this program, you can receive up to $4,000 as a one-time support for past due rent. Here are the documents you will need: valid ID, current lease agreement, paycheck stubs, preferably one prior to COVID and one showing how you're paid now. We can also include the EDD award letter. Proof of COVID crisis, which will be a notice you would get from your landlord or leasing company showing the months and the amount that you are currently behind for your past due rent. We will also request a W-9 form from the landlord or leasing company. Once you are approved, the check will be made payable directly to your landlord. Checks are normally issued every Friday. Now, something I have to tell you about this particular pot of money is that it ends on December the 31st, 2020. So we want to make sure that everyone who needs it gets it. So please, if you need assistance, Please reach out as soon as possible by calling me at 510-899-1666 or shoot an email to me, clientservices@rootsclinic.org. And if you know someone who may be in need of this assistance, please let them know. I am very thankful that Roots chose me to provide assistance to our community, as I know it has relieved so much stress during this pandemic. And now back to Dr. Noha for some final words. Thank you.
Thank you for that, Karina. And now here's our best advice one more time. A negative test is not your ticket to let loose. You need to either quarantine for a full 14 days or do not come into close contact. Keep it small, keep it short, keep it outside. Mask up and space out when you are with those from other households, even if they are family. If you have experienced any hardship due to COVID, please act now, as many COVID relief programs are set to end on December 31st. Protect your elders and those with underlying conditions to the best of your ability, even if it means you can only see them by video this year. Stay safe, stay healthy, and enjoy your holiday. That concludes today's People's Health Briefing. Please submit your questions in the chat or by direct message or email to admin@rootsclinic.org. Please join us next Tuesday at 10 a.m. See you then.